Good day, everyone. I am Navarro, and we are the reporters for today, together with Miss Ibabaw and Miss Espino. So, our topic for today is all about healthcare marketing. So, we have some brief history about the healthcare marketing, or this is called competitions for the healthcare. So, the number of the Americans who are diabetic has even continued to rise, or doubling from the year 1990 to 2005. And one of the every three children was born in mid 2000 will develop the diabetes in his or her lifetime. This is the introduction of healthcare marketing. As the healthcare industry is characterized by an intense and ever increasing rivalry, market becomes all the more essential as mechanism for achieving success. Marketing can broadly be defined as a management process that involves the assessment of the customer's want and their needs, and the performance of all the activities associated with the development, pricing, provision, and promotions of the product. Solutions that satisfy those wants and needs. Although the most often associated with the advertising and sales, marketing is much more encompassing. So it is a definition implies. So aside from the promotion and even the activities, marketing includes such critical function as an environmental scanning, wants and needs assessment. So new product development, target marketing, product pricing, product distribution, and market research is important. So, what does this all mean for those of us who had a primary business is to market a hospital service? So, it means that marketers must work closer and more diligently with their company or even their organizations to help bring about the systematic change in health status of the peoples as they serve. So it means that like other industries, they rely upon the combination of technology and highly specialized professionals. Hospital marketer must balance marketing of what patients need and what they want. So thinking inside and outside of the box is always looking for the way to simplify and humanize the patient care experience. So this is the most important than ever. And also, hospital marketers must lead their organizations in going to the right thing. So, to be familiarized, healthcare marketing is a process of strategic outreach and communication designed to attract healthcare consumers. So, guide them through their healthcare journey and keep them engaged with the healthcare system. So, a successful healthcare marketing, they usually begin with a campaign with the process of developing marketing strategy and communications to reach a new patient and improve the patient care. So, by developing an open line of a communication between providers or healthcare organizations between their patients. Lastly, healthcare marketing seeks to deliver a valuable content and resources to patients across the care continuum using website, social media platforms, advertising, email, marketing, videos, and many more mediums. To begin with, they transformed traditional hospital marketing from a vacation obsessed with market share and return on investment to one that promotes the innovative methods for disease prevention and personalized self-health management. So involve community members in hospital service delivery, build and strengthen relationship with non-traditional healthcare players, and lastly recognize the wisdom that is inherent in our employees and focus on more effort on creating a workforce that revolutionize the way in which we combine productivity with the customer service. Meaning to say, the application of the marketing in the field of the healthcare was imposed by the problems in the health of the society. So, an effective marketing approach involves in depth investigations of the patient's needs. So, identifying their needs and offering a new health services that the patients have not explicitly requested. So, patients' involvement in the achievement of the medical act is important because later on, the healthcare marketing allows you to increase your patient connection and nurture those relationships for long term or even the loyal patients. So, this is the successful marketing that leads you to success of your patient engagement to approach the public health promotion that applies the marketing principle ensures approach to public health promotion that applies the marketing principles and enables the healthcare marketing organizations to gain more exposure for their achievements, such as advancement in the medicine, and likewise. The marketing strategy would follow the traditional purpose of marketing, namely the product, place, promotion, and price. So, in the case of the healthcare marketing, product refers to the surgical procedure, place refers to the access to this procedure, promotion refers to creating awareness and demand of the procedure, and lastly, price refers to the cost of the procedure, and it involves the money, time, and reputation of the hospital. So, healthcare marketers in the healthcare industry faces a unique challenges in achieving their goals. So, regulations such as health insurance and portability. By solving challenges in a healthcare requires the patient. So, a motivated team and perhaps some custom integration development is an advancement despite of all the challenges they face. As a healthcare marketers, you should take pride in connecting patients with the physicians to get them one step closer to the expertise and treatment key that they need. Hospitals need to be there when needed. With this, hospital matter to people and often mark central point of their lives. They also matter to health system by being instrumental for care coordination and integration. They often provide a setting for education of the doctor, nurses, and other healthcare professionals and are critical base for a clinical research. Hospital played an essential role or even a part of a healthcare system development. They are currently external pressures, health system shortcomings and hospital sector deficiencies. So they are driving a new visions for hospital in many parts of the world. So in this vision, they have a key role to play to support other healthcare providers and for community outreach and home-based services, and they are essential in a well-functioning referral and networks. This hospital is a healthcare institutions providing a patient treatment with a specialized health science and auxiliary healthcare staff and medical. Hospitals are classified as general, specialty, or government depending on the sources of income they receive. Hospitals are typically funded by the public funding, health organizations for profit and non-profit, health insurance companies, or charities including the direct charitable donations. Historically, hospitals were often founded and funded by a religious order or by charitable individual and leaders. Hospitals have a large staff by professional physicians, surgeons, nurses, and allied health practitioners, whereas in the past, this work was usually performed by the members of founding religious orders or by volunteers. This hospital had a high demand because people are always in need of the healthcare. So hospital must employ a large number of the people in both patient care and business position to operate effectively. The value of healthcare marketing is often intangible. The marketing was pursued normally begin with assessing the wants and needs of the customer. So the term wants and needs are often used interchangeably in society. So a need is a something that a person requires for a well-being and possibly survival, while the want is a something that a person simply desires. Healthcare service organizations rely on the variety of the intangible asset to create business value, including patient and customer relationship, medical record, trade names, assembled workforce, licenses and certifications, non-compete clauses, proprietary technology, software, and others. So, what is intangible healthcare? So, these healthcare organizations, such as physician practice, hospital, or other medical service providers, that typically possess many types of value and intangible assets. So these include the personal and professional goodwill, practices, protocols, and treatments plan, and non-competing convenience among others. This intangible healthcare may also have an intangible asset, which is also provide a service agreement, an assembled workforce in a place, franchise and licensing agreements, or even a joint venture and alliance of software network and integrations. One of the greatest tools in intangible marketing, the ability to create an emotional connection to a product that results in the consumer buying the products or services. The intangible product is travel insurance, repair, consulting, computer software, investment banking, education, healthcare, and accounting that can seldom be tried out, inspected, or tested in advance, while the tangible is the asset that are generally anything you can physically touch, from inventory to buildings to copying machines. So intangible asset, meanwhile, are anything valued that you can physically touch, such as the trademarks names and the goodwill you built up around your company's reputations.